Hello, my name is Catalina Garcia, and this is my presentation on pulmonary surfactant. So first, we're going to go into an overview of this mini presentation. We will go into a general overview of pulmonary surfactant, what it is, and where it functions in the body, and then we will go into the research implications of this topic. So, pulmonary surfactant. Surfactant works by interspacing itself between water molecules and the fluid lining of the alveoli, and it works to lower alveolar surface tension. So it is secreted from type 2 alveolar cells, and its main composition is of proteins and lipids, which helps in its function. This image to our right is going to be a visual representation of what's happening in the alveoli, as well as how pulmonary surfactant works in the physics of our alveoli. But we will go into this picture after we go into a deeper overview of surfactant. So, pulmonary surfactant works by lowering alveolar surface tension. It provides two important benefits. The first being, as we already stated, increased pulmonary compliance, which means that it reduces the work of initiating breathing by the lungs. So it reduces the work lungs have to do, the energy they need to breathe. And then the second benefit is that it reduces lung tendency to recoil so that they don't collapse. So this liquid essentially works because of the cohesive force between a water molecule and then the adjacent pulmonary surfactant molecule is very low. So this force between the water molecule and surfactant, which is composed inside of the alveoli, is very low, which decreases the tendency of collapsing. Further, the pulmonary surfactant decreases the extent of hydrogen bonding between water molecules. So our alveoli have water inside of them, and if these water molecules do not have surfactant interspersed between them, then the tension between hydrogen covalent bonds is strong enough to cause the alveoli to collapse. So surfactant intersperses itself between the alveoli inside the alveoli between the hydrogen, between the water molecules, causing a bond that is weaker than if water molecules were solely inside the alveoli. So the bond created between the surfactant and the water molecules is strong enough to do its job, but not strong enough to cause the alveoli to collapse. So again, the pictures we will get into in a minute, but this slide just reiterates what we were saying. So the main functions being that it works to stabilize the size of the alveoli, keeps alveoli open so that gas exchange can occur, as well as reducing the work that the lungs do for breathing. So going further into the alveoli, the pulmonary surfactant, as we stated, reduces the tendency of alveoli to recoil, discouraging alveolar collapse, as well as maintaining lung stability. As we know, the division of the lung is into a myriad of alveoli, which are these tiny air sacs, which function to provide an increased surface area for gas exchange between O2 and CO2 to occur. And so these alveoli are what we've been talking about, and because of how they are created, how they form, and how they present themselves, there is a problem that is presented in the maintaining of the stability of the alveoli. So going into these pictures, from this first picture we see the physics law that enacts here that we see affecting alveoli and the pressure is the law of Laplace. So this law stating that the magnitude of the inward direct pressure, which is P in our formula here, in a bubble is equal to 2 times that surface tension over the radius of the bubble. So this is the physics law that is enacting on these alveoli, which helps explain the collapsing tendency. So from this first picture we see, according to the law of Laplace, if 2 alveoli of unequal size, so we see a big one and a small one here, have the same surface tension and are connected by a terminal airway, which we know they are, this means that the smaller alveoli seen here has a tendency to collapse because it generates a larger inward directed collapsing pressure. So again, both of these alveoli have the same surface tension on them, but are of unequal size, causing a tendency and this is without surfactant. So without surfactant, the smaller alveoli has a tendency to collapse and empty itself into the larger alveoli. So that's what we see here in this picture. And in this picture we see here with surfactant, we can see that the pulmonary surfactant reduces the surface tension of the smaller alveoli more than that of the larger alveoli, which causes a reduction in the surface tension that offsets the effect of the smaller radius in determining the inward directed pressure. All this to say that the surfactant works to reduce the surface tension on this smaller alveoli so that the inward pressure is not causing a collapse. And so that's why we need surfactant. We can see mathematically here, that's why we need surfactant to work itself in between the water molecules that are causing this great pressure, causing collapse in our lungs alveoli. Again, these alveoli are necessary for gas exchange and work for gas exchange where CO2 and O2 function there. So our alveoli, very important. The unequal size with the same surface tension, cause a tendency for collapse of these alveoli, and that is why we need surfactant working within this to decrease surface tension, decreasing the ability and tendency of collapse. So going into now our research, we have research by Meng et al. 2019 that looked into the effect of surfactant administration on adults that have ARDS. So ARDS being acute respiratory distress syndrome. And just a quick analysis on this disease. So acute respiratory distress syndrome occurs when there is a fluid buildup in the alveoli of our lungs. The fluid that keeps our lungs from filling with enough air. Sorry, what I mean to say is that the buildup of this fluid prevents oxygen reaching our bloodstream because it keeps the lungs filled with fluid instead of the air, which then deprives our organs of the oxygen that they need. Acute respiratory distress syndrome often occurs in those patients who are critically ill or have severe injuries, and they suffer from shortness of breath. This disease can actually occur over a few hours or within a few days of injury or infection. So it may not happen suddenly, and it may not happen while the patient is actually in the hospital treating whatever disease or illness that triggers it. So into this research, these researchers looked at the effect of surfactant administration on these patients. Again, surfactant working to decrease the bonds between water molecules, decreasing the tendency of alveoli to collapse. So it was actually a meta-analysis of 11 randomly controlled trials. And surprisingly, working through comparing a surfactant therapy group to a placebo group, so a group with no surfactant therapy, they actually did not find that surfactant administration improved mortality rates on these adult patients. They did not find that there was an improvement of oxygenation of these patients with acute respiratory distress syndrome, which is surprising because as we learned from these pictures, surfactant works to decrease the effects of fluid in the alveoli, and here the mortality rates of those patients who had surfactant therapy versus those who did not was not significant. It was not different. So again, of course, further testing of randomized trials should explore the surfactant therapy on patients with ARDS, but based on this meta-analysis of 11 randomly controlled trials, there was not a significant effect on mortality from patients that had surfactant therapy for acute respiratory distress syndrome compared to those who did not. So just to reiterate that was a lot of information, just to reiterate what we said. Surfactant is a necessary liquid inside of the alveoli, again, secreted by type 2 alveolar cells. It is composed of proteins and lipids, and it works to prevent lung collapse by interspersing itself between water molecules in the alveoli, decreasing the bonding between those molecules. So the surfactant will create a bond with the water molecules, but this bond is less than that of 2 water molecules, so decreasing the alveolar tendency to collapse. And again, these pictures just being a physics representation of this force relationship in the alveoli. So again, pulmonary surfactant works to decrease the work on the lungs as it works to breathe. It stabilizes the size of alveoli, again, reiterating how a smaller alveoli without pulmonary surfactant will collapse, emptying itself to a bigger alveoli that it is connected through an airway. And so surfactant works to keep alveoli open, no matter the size, decreasing its surface tension as necessary so that alveoli are free, open, and able to participate in gas exchange. And again, research looking into respiratory distress syndrome, which occurs when alveoli are full of liquid, leaving no room for gas exchange to occur. And researchers thought that administering surfactant therapy onto adults with this syndrome would benefit them in the long run, but we did see from this meta-analysis of 11 controlled trials that there was no significant difference in mortality rates between groups that had surfactant therapy versus those who did not have surfactant therapy. So again, this is, here are my references. Again, this was my presentation, Catalina Garcia, my presentation on pulmonary surfactant. Thank you very much.